NCSBN-NCLEX RN 800 questions and answers newest real exam simulation. Question 1. What is the initial treatment for a liquid chemical burn injury? Option A. Irrigate area with neutralizing solutions. Option B. Flush area with large amounts of water. Option C. Inject calcium chloride. Option D. Apply lanolin ointment. The correct answer is option B. Flush area with large amounts of water. Large amounts of water are recommended to flush the area of a chemical burn to prevent extension of the burn injury. Question 2. Why must circumferential burns be assessed every hour? Option A. They lead to hypovolemia. Option B. They cause renal damage. Option C. They lead to ventricular arrhythmias. Option D. They result in loss of peripheral pulses. The correct answer is option D. They result in loss of peripheral pulses. Full-thickness circumferential burns result in an internal tourniquet effect that compromises distal blood flow when an extremity is involved. Question 3. Why is morphine primarily administered intravenously in burn therapy? Option A. It delays absorption. Option B. Absorption from muscles is not dependable. Option C. Allows for discontinuance if respiratory depression develops. Option D. Avoids pain from injections. The correct answer is option B. Absorption from muscles is not dependable. Medications remain in interstitial fluid during the acute phase of burn injury, making intramuscular absorption unpredictable. Question 4. Which medication best penetrates eschar? Option A. Mefenide acetate. Option B. Silver sulfadiazine. Option C. Neomycin sulfate. Option D. Povidone iodine. The correct answer is option A. Mefenide acetate. Mefenide acetate is bacteriostatic against gram-positive and gram-negative organisms and best penetrates eschar. Question 5. What physiological changes are expected 18 to 24 hours after a major thermal burn? Option A. Elevated serum sodium. Option B. Elevated serum calcium. Option C. Elevated serum protein. Option D. Elevated hematocrit. The correct answer is option D. Elevated hematocrit. The hematocrit level is elevated due to hemoconcentration from hypovolemia. Question 6. Which topical burn medication may cause hyperventilation due to metabolic acidosis? Option A. Neosporin sulfate. Option B. Mefenide acetate. Option C. Silver sulfadiazine. Option D. Povidone iodine. The correct answer is option B. Mefenide acetate. Mefenide acetate side effects include metabolic acidosis resulting in compensatory hyperventilation. Question 7. What is the primary reason for sending a burn client home with a pressure garment? Option A. Decreases hypertrophic scar formation. Option B. Assists with ambulation. Option C. Covers scars for psychological reasons. Option D. Increases venous return. The correct answer is option A. Decreases hypertrophic scar formation. Uniform pressure of 10 to 20 mm of mercury is necessary to prevent or reduce hypertrophic scarring. Question 8. Which food is high in potassium to prevent depletion in a client with emphysema taking diuretics? Option A. Celery. Option B. Potatoes. Option C. Tomatoes. Option D. Liver. The correct answer is option B. Potatoes. Potatoes are an excellent source of potassium for clients on diuretic therapy. Question 9. What is expected following respiratory assessment of a client with advanced emphysema? Option A. Distant breath sounds. Option B. Increased heart sounds. Option C. Decreased chest diameter. Option D. Collapsed neck veins. The correct answer is option A. Distant breath sounds. Distant breath sounds occur in emphysema due to increased chest diameter overdistension and air trapping. Question 10. A client with emphysema becomes short of breath while returning to bed. What is the appropriate nursing action? Option A. Increase nasal oxygen to 6 liters per minute. Option B. Place in lateral Sims position. Option C. Encourage pursed lip breathing. Option D. Have client breathe into a paper bag. The correct answer is option C. Encourage pursed lip breathing. Pursed lip breathing helps the client blow off carbon dioxide and keep air passages open. Question 11. Signs and symptoms of an allergy attack include? Option A. Wheezing on inspiration. Option B. Increased respiratory rate. Option C. Circumoral cyanosis. Option D. A prolonged expiration. The correct answer is option D. Prolonged expiration. Expiration is prolonged because the alveoli are greatly distended and air trapping occurs. Question 12. Which group is at high risk for contracting hepatitis? Option A. Heterosexual males. Option B. Oncology nurses. Option C. American Indians. Option D. Jehovah's Witnesses. The correct answer is option B. Oncology nurses. Oncology nurses perform invasive procedures that expose them to potential sources of infection. Question 13. What are characteristics of hepatitis C? Option A. A potential for chronic disease is minimal. Option B. The onset of symptoms is abrupt. Option C. Incubation period is 2 to 26 weeks. Option D. There is an effective vaccine. The correct answer is option C. Incubation period is 2 to 26 weeks. The incubation period for hepatitis C is 2 to 26 weeks. Question 14. What is the most therapeutic diet for a client with hepatitis? Option A. High protein and low carbohydrate. Option B. Low calorie and low protein. Option C. High carbohydrate and high calorie. Option D. Low carbohydrate and high calorie. The correct answer is option C. High carbohydrate and high calorie. Increased carbohydrates provide needed calories and protein increases the workload of the liver. Question 15. Which nursing order should be included for a client with hepatitis C? Option A. Use universal precautions for blood samples. Option B. Maintain total bed rest. Option C. Maintain low semi-Fowler position for eating. Option D. Administer alcohol backrub. The correct answer is option A. Use universal precautions for blood samples. Hepatitis C is transmitted via blood products, making universal precautions essential. Question 16. A diabetic client has a blood glucose of 50 mg and dinner is served in 30 minutes. What is the best action? Option A. 3 tablespoons of sugar in juice. Option B. 3 pieces of hard candy. Option C. 4 ounces of orange juice. Option D. Monitor closely. The correct answer is option C. 4 ounces of orange juice. 4 ounces of orange juice acts immediately to raise blood sugar to a normal level until dinner is served. Question 17. When does regular human insulin peak? Option A. 30 minutes after administration. Option B. 1 hour after administration. Option C. 2 to 4 hours after administration. Option D. 16 hours after administration. The correct answer is option C. 2 to 4 hours after administration. Regular insulin peak action occurs 2 to 4 hours after administration. Question 18. Which is true regarding exercise for a client with type 1 diabetes? Option A. Exercise should be performed 30 minutes before meals. Option B. A snack may be needed before or during exercise. Option C. Hyperglycemia may occur 24 hours after exercise. Option D. A glucose should be 100 or below before exercise. The correct answer is option B. A snack may be needed before or during exercise. Exercise lowers blood sugar levels, so a snack may be needed to maintain appropriate glucose levels. Question 19. An elderly client with an indwelling catheter feels an urge to void. What is the initial appropriate action? Option A. Assure her this is due to bladder spasms. Option B. Check collection bag in tubing. Option C. Instruct her to do Kegel exercises. Option D. Ask if she has felt this way before. The correct answer is option B. Check collection bag in tubing. The most frequent reason for an urge to void with an indwelling catheter is blocked tubing. Question 20. Nursing interventions to decrease the risk of infection in a client with an indwelling catheter include? Option A. Cleanse area around meatus twice daily. Option B, empty catheter drainage bag daily. Option C, change catheter tubing in bag every 48 hours. Option D, maintain fluid intake of 1,200 milliliters. The correct answer is option A, cleanse area around the anus twice daily. Catheter site care is to be done at least twice daily to prevent pathogen growth. Question 21. What teaching indicates the client needs further instruction to prevent urinary tract infections? Option A, drink at least 8 ounces of cranberry juice daily. Option B, maintain fluid intake of at least 2,000 milliliters daily. Option C, wash hands before and after voiding. Option D, limit fluid intake after 6 p.m. The correct answer is option D, limit fluid intake after 6 p.m. Restricting fluid intake contributes to urinary stasis, which in turn contributes to bacterial growth. Question 22. Which food choices help prevent constipation? Option A, omelette and hash browns. Option B, pancakes and syrup. Option C, bagel with cream cheese. Option D, cooked oatmeal and grapefruit half. The correct answer is option D, cooked oatmeal and grapefruit half. Oatmeal and fresh fruit provide fiber and intestinal bulk to prevent constipation. Question 23. What teaching indicates the client understands how to reduce risks of furosemide therapy? Option A, rise slowly and sit for a few minutes after lying down. Option B, walk at least 2 to 3 blocks daily. Option C, restrict fluid intake to 4 glasses a day. Option D, stop taking aspirin. The correct answer is option A, rise slowly and sit for a few minutes after lying down. Rising slowly helps prevent the occurrence of postural hypotension, a common side effect of diuretic therapy. Question 24. What symptoms of eye infection and hemorrhage should the client be instructed to monitor for? Option A, blurred vision and dizziness. Option B, eye pain and itching. Option C, feeling of eye pressure and headache. Option D, eye discharge and hemoptysis. The correct answer is option B, eye pain and itching. Eye pain is a symptom of hemorrhage and itching is associated with infection. Question 25. Why is the yearly influenza vaccination important for geriatric clients? Option A, influenza is growing in our society. Option B, older clients are sicker when stricken. Option C, older clients have less effective immune systems. Option D, older clients have more exposure to causative agents. The correct answer is option C. Older clients have less effective immune systems. As people age, their immune system becomes less effective, increasing their risk for influenza infection. Question 26. Which menu choice helps restore albumin levels in a client with pressure ulcers? Option A, broiled fish with rice. Option B, bran flakes with fresh peaches. Option C, lasagna with garlic bread. Option D, cauliflower and lettuce salad. The correct answer is option A, broiled fish with rice. Broiled fish and rice are both excellent sources of protein required for wound healing. Question 27. A client has difficulty chewing and swallowing food. What response reduces this problem? Option A, full liquid diet. Option B, 5 small meals. Option C, mechanical soft diet. Option D, pureed diet. The correct answer is option C, mechanical soft diet. A mechanical soft diet is easier to chew and swallow because food items are of a consistent texture. Question 28. What statement indicates a client with pancreatitis understands how to prevent another recurrence? Option A, I will not eat any raw vegetables. Option B, I will limit alcohol to 1 cocktail per day. Option C, I will look into attending Alcoholics Anonymous meetings. Option D, I will report changes in bowel movements. The correct answer is option C. I will look into attending Alcoholics Anonymous meetings. The client must avoid alcohol entirely, and Alcoholics Anonymous is an appropriate support resource. Question 29. A client with a gastric ulcer is a heavy smoker. What should the nurse advise? Option A, smoke low-tar filtered cigarettes. Option B, smoke cigars instead. Option C, smoke only after meals. Option D, chew gum instead. The correct answer is option C. Smoke only after meals. Smoking on a full stomach minimizes the effect of nicotine on gastric acid secretion. Question 30. What is a nursing implication for the administration of iron dextran? Option A. It is called intrinsic factor. Option B. Must be given in the abdomen. Option C. Requires use of the Z-track method. Option D. Should be given subcutaneously. The correct answer is option C. Requires use of the Z-track method. The Z-track method of injection is required to prevent staining and irritation of the tissue. Question 31. A client with a nasogastric tube exhibits restlessness and blood pH of 7.53. What is experiencing? Option A. Hyperkalemia. Option B. Hyponatremia. Option C. Metabolic acidosis. Option D. Metabolic alkalosis. The correct answer is option D. Metabolic alkalosis. With a nasogastric tube attached to suction acids are removed leading to metabolic alkalosis. Question 32. A client has muscle weakness and a serum potassium of 3.2. What other symptoms might he exhibit? Option A. Tetany. Option B. Dysrhythmias. Option C. Numbness of extremities. Option D. Headache. The correct answer is option B. Dysrhythmias. Low potassium causes dysrhythmias because potassium is responsible for cardiac muscle activity. Question 33. What action alleviates distress from dumping syndrome after gastric resection? Option A. Eat 3 large meals a day. Option B. Drink small amounts of liquids with meals. Option C. Take a long walk after meals. Option D. Eat a low carbohydrate diet. The correct answer is option D. Eat a low carbohydrate diet. A low carbohydrate diet prevents a hypertonic bolus, which is the cause of dumping syndrome. Question 34. What is a nursing implication for the drug azulfidine? Option A. Limit fluids to 500 milliliters daily. Option B. Administer 2 hours before meals. Option C. Observe for skin rash and diarrhea. Option D. Monitor blood pressure and pulse. The correct answer is option C. Observe for skin rash and diarrhea. Sulfasalazine used for ulcerative colitis may cause skin rash and diarrhea. Question 35. Which medication would the nurse question for a client with ulcerative colitis? Option A. Methylprednisolone sodium succinate. Option B. Loperamide. Option C. Psyllium. Option D. 6-mercaptopurine. The correct answer is option D. 6-mercaptopurine. An immunosuppressant like 6-mercaptopurine is used for chronic unrelenting Crohn's disease, not ulcerative colitis. Question 36. In preparing a client for a liver biopsy, the nurse should: Option A. Keep client NPO for 24 hours. Option B. Practice holding breath for 1 minute. Option C. Give a laxative to prevent distended bowel. Option D. Explain that vital signs will be checked frequently. The correct answer is option D. Explain that vital signs will be checked frequently. Following a liver biopsy, the client is watched for signs of hemorrhage and shock. Question 37. What is the best position for a client after a liver biopsy? Option A. High Fowler. Option B. Prone. Option C. Supine. Option D. Right lateral. The correct answer is option D. Right lateral. The right lateral position applies pressure on the liver to help prevent bleeding. Question 38. What complication should the nurse be alert for following a liver biopsy? Option A. Hepatic coma. Option B. Jaundice. Option C. Ascites. Option D. Shock. The correct answer is option D. Shock. Hemorrhage and shock are the most likely complications after a liver biopsy due to the vascular nature of the liver. Question 39. What nursing implication is appropriate for a client undergoing a paracentesis? Option A. Have client void before procedure. Option B. Keep client NPO. Option C. Observe for hypertension. Option D. Place client on right side following procedure. The correct answer is option A. Have client void before procedure. A full bladder is at risk of being punctured and would impede the withdrawal of acidic fluid. Question 40. What statement by the client shows understanding of fertility awareness for conception? Option A. Have intercourse when cervical mucosa is thick and cloudy. Option B. At ovulation, basal body temperature should rise about 0.5 degrees. Option C. Douche immediately after intercourse. Option D. Have sexual intercourse on day 14 regardless of cycle length. The correct answer is option B. At ovulation, basal body temperature should rise about 0.5 degrees. Under the influence of progesterone, the basal body temperature increases slightly after ovulation. Question 41. A client with a 34-day cycle is most likely to ovulate on what day? Option A, 14. Option B, 16. Option C, 20. Option D, 22. The correct answer is option C, 20. Ovulation occurs 14 plus 2 days before the next menses, so 34 minus 14 equals 20. Question 42. A pregnant client last menstrual period began January 15. What is the expected date of delivery? Option A, October 8. Option B, October 15. Option C, October 22. Option D, October 29. The correct answer is option C, October 22. Using Nagili rule, subtract 3 months and add 7 days to January 15. Question 43. What does the nurse mean by vena cava syndrome in a pregnant client? Option A. A blood pressure increases sharply with changes in position. Option B. A blood flow from the extremities is blocked or slowed. Option C. It is seen mainly in first pregnancies. Option D. May require medication. The correct answer is option B. Blood flow from the extremities is blocked or slowed. Pressure of the gravid uterus on the inferior vena cava decreases blood return from the lower extremities. Question 44. A client is pregnant for the third time, has had 1 full-term birth and 1 preterm birth. How is this recorded? Option A, 32002. Option B, 22022. Option C, 31102. Option D, 21102. The correct answer is option C, 31102. The client is in her third pregnancy, delivered 1 full-term child and 1 preterm child with no abortions and 2 living children.